If you have leg pain, especially after walking, exercise, or climbing upstairs, it could be a sign of peripheral artery disease or PAD. PAD is a serious condition, and it can be a warning sign for heart attack or stroke. It is caused by a buildup of plaque that narrows the arteries in the legs, causing reduced blood flow. Symptoms can include leg pain, wounds on the legs that do not heal, and a loss of hair on the lower legs. At Star Vascular and Interventional, minimally invasive treatments are available to treat PAD without surgery, without downtime, and with no hospital stay. The procedures we perform include atherectomy and angioplasty. During atherectomy, a catheter is placed within the blocked artery. A special blade or burring device removes plaque from the artery wall and pulls it out of the body via the catheter. With angioplasty, a catheter is placed within the blocked artery. A special balloon is then inflated to open the artery and restore blood flow. In some cases, a stent or small metal scaffold may be permanently placed within the blood vessel to help keep it open. After a short observation period, the patient can return home. Most people experience immediate pain relief from these procedures. If you are at risk for PAD or think you might have it, talk to your doctor or visit northstarir.com for more information.